Hello everyone and welcome to this webinar. Today's topic of the webinar is looking at how to make your maternal mobile health service more gender inclusive. So we're going to look specifically at some key principles and tips for reaching women. My name is Alexandra Tyers and I'll be the host of your webinar. A little bit about me. I am a gender and mobile specialist. I've been working for many years on developing and designing services, specifically mobile services, specifically for women, and mobile services that are gender inclusive. I have a particular interest in women's access to and the use of mobile. So this webinar and its accompanying toolkit is based on best practices from my own experience, best practices from experiences of other mobile projects, and from the wider research. In today's webinar, we're going to be looking at first of all, the business case for women. So why women? What is the business opportunity in creating mobile services for women? What is the social opportunity? We'll be looking at market assessment, so understanding how much access women have to mobile in your market, understanding how they use their mobile, and understanding what their wants and needs are. We'll then move on to look at product and service design, so looking particularly at how to make a gender-friendly platform, how to make content gender-friendly, and how to do user testing with women. We'll move on then to look at pricing and bundling to ensure that you get the best possible costs or prices to make your service gender inclusive. We'll move on to look at marketing and promotion and the best way to reach women, and we'll finish by looking at monitoring and improving. Okay, so the first section we're going to look at is why women? Why does it matter? In terms of a social opportunity, we're not going to look too much at the social opportunity because of time, but generally the kind of accepted social opportunity for creating mobile services, mobile health services for women is targeting women specifically leads to improved nutrition and healthier children. It also leads to the reduction of maternal and child mortality. It leads to social and economic empowerment of women, and then improved livelihoods for these women, their families, and their communities. But specifically for our purposes, looking at the business opportunity, what are the sort of things that mobile operators and value-added service providers might be interested in terms of thinking about why it would be important to design a service for women? You know, women represent a large untapped business opportunity in mHealth. You know, there are direct and indirect commercial benefits for the mobile industry. You know, the first one is direct, it's revenue. Globally, 1.7 billion women do not own phones. So targeting these women could add 170 billion US dollars to the mobile industry by 2020. A really good example of this is Telenor in India. They designed a specialized tariff plan aimed at bringing in females specifically and their husbands. This tariff plan brought in 30% of all their new customers in their footprint. They found that 77% had switched from their competitors, and these burned-down customers, the plan, they had a higher ARPU than other subscribers. So clearly that's a very good example of the massive revenue opportunity that reaching women can provide. But in terms of indirect commercial benefits, there are a few as well. The first one is improved brand perception. Women are often the main communication channels of their communities. They're often trusted sources of product recommendations. So a brand that serves women is more likely to be seen in a positive way if female users are happy with it. This was done to great effect in Mali by Orange. They launched a savings and maternal health insurance product for women, which helped create a more positive brand perception. 95% of their female users said they would recommend Orange to their friends and family. Another indirect benefit is reduced churn. When women subscribe to a service, it often means involving the whole family. And once an entire household signs up to a network, it's much more difficult for them all to switch to a competitor. So women who are happy with the service often become loyal to the brand. For example, in Pakistan, Telenor designed a maternal and child health VAS called mHealth. It was aimed at a female segment, and it fostered extremely high levels of customer loyalty. So the average monthly churn rate for Telenor's VAS portfolio was 20%, but for this particular one aimed at women was only 8.2%, so a very large difference there in churn. And a final indirect benefit is spillover. What we've seen, and we'll see this a little bit later on, is that women tend to use fewer mobile services than men. This is generally because they're less comfortable with mobile. So developing a service that meets their needs can encourage them to become more comfortable with mobile in general. And then this can also encourage uptake of other services and more profitable services such as data. So, for example, a good example of this is in Madagascar, HNI and Airtel Madagascar. They launched a 321 VAS, which was aimed at women, and they saw an increase in overall SMS usage. So the female 321 users used SMS 140% more than the average Airtel subscriber. So clearly there is a very good business case to reach women. And that is one way that can be presented to mobile operators to persuade them to think about tapping into this market. But once you've got them on board and you've decided, yes, we definitely want to launch a service for women, the first step you'll need to do is to understand your market and understanding your female users, who they are, what their access to mobile is, and how they use mobile. The first thing we need to know is that women do not have the same access to mobile phones as men. As I'd mentioned, over 1.7 billion women worldwide don't own mobile phones. And what this translates to is that women are 14% less likely to own a mobile phone than men. So 200 million fewer women than men. But this number is a global figure. There are actually a lot of regional disparities. So in South Asia, this is the highest mobile gender gap. So women in South Asia are 38% less likely to own a mobile phone. So that means 72% of women in South Asia do not own a mobile phone. Across sub-Saharan Africa, the gender gap is 13%, meaning that 13% are less likely to own a mobile phone. So 27 million women do not own a mobile phone. But that, again, is an average. It's very different across different parts of sub-Saharan Africa. So, for example, in East Africa, the gender gap is only 8%. But in West Africa, it's much higher. Look at Niger, for example. Niger has a huge gender gap of 45%. So it's really important to understand, first of all, that women may not have access. But if they do have access, what we have seen is that there is a growing gap in usage as well. What that means is women often use mobiles in different ways to men. So low-income women tend to have more basic handsets than men, and they often only use voice services. They're much less likely than men to use SMS. They're much less likely to use more advanced services such as mobile money or mobile data. And women are much more likely to share or borrow mobile phones. They're much less likely to have one of their own. And they tend to share with other female relatives. They may share with their husbands, or they may share with their communities. So understanding, first of all, the levels of, ownership and access, and then the levels of use in your market is really important. It's also really important to understand the reasons behind this gender gap. There's no one universal reason for why women have and use mobiles less than men, but there are several common themes. The first one is cost. Women often have different price sensitivities. They'll have much less disposable income than men, and they'll often have less control over their finances. So this means they are much more affected than mobile-related costs than men. Another issue is digital literacy. Women, especially rural women, tend to have lower levels of education. And so then that means they have lower levels of literacy. And so therefore they have lower levels of technical literacy. They often have lower levels of confidence in using mobile because of this. They're more worried about making mistakes. And so they tend to use less services. Another reason which is related to this is around social norms. Mobile access and use, it doesn't happen in a vacuum. If there are restrictions in women in society, these are often mirrored in their ability to access and use a mobile phone. And gatekeepers or decision makers, and these are very often husbands, they can control how a woman uses her mobile or if she even owns one. Another reason related to this, which is a growing one, is around security and harassment. So in many communities, people worry that if women do have mobiles, they may be harassed by men, for example, who obtain their mobile numbers or their social media profiles. And in some communities, there also is a strong perception that mobile use amongst women may lead to promiscuity. Another reason for women's lack of access or lack of use is around network coverage. While both rural men and women may face network or coverage issues, women are often more affected by this because they may have less freedom because of social norms than men to travel to locations to get better networks or coverage. And the final barrier that's been identified is around agent or operator trust. In many communities, there is a perception that mobile operators and their agents, their field agents, are not very trustworthy. So women who have lower levels of digital literacy may need more help in using mobile services, but they are reluctant to get this from agents because they often don't trust them, and the agents are predominantly male. So this is also a barrier this is a barrier to women's mobile access and use. So now that we understand that, first of all, there is a massive business opportunity, but there is also a large mobile gender gap in women's access and use of mobiles and the reasons behind it, then we can move on to seeing how we can apply these into our product and service design. So ensuring that we have designed your mobile service for a female user experience as well as a male. The first thing to think about is some general tips. In my experience, designing service for women and low-income women and rural women, often they have lower, as I mentioned, lower levels of reading and writing skills. They may have lower levels of digital or technical literacy. They may have lower levels of confidence than men. They may have more basic handsets. They may have less experience using complex services. So taking all these things into account and planning for this user experience can help bring in more women and retain them, engage them, rather than not making it user-friendly for them so they drop out. The first thing is being device agnostic. So ensuring that any mobile content can be run on any handset type, not designing for something that can only be run on smartphones, for example. Another way also to get around some literacy issues is using audio. So using an audio platform can reach more women. Lower literacy levels means that they may be less comfortable with SMS or written content. So using IVR, that's interactive voice response, to engage and retain them. Another option is using radio. Women often listen to radio on their phones, particularly if they're sharing them. They may listen in a group. So developing an engaging mobile radio show, it could be a good option to reach women. Another thing to think about is signposting and instructions. As I mentioned, female users, they often need more support and guidance throughout the mobile service. They may be more worried, they may feel less confident. So to ensure they engage fully and to prevent drop-off, a couple of suggestions here. First, keeping instructions clear. Keep your main messages at the beginning of the instruction. So if you want them to press 1 after doing something, say press 1 first instead of then press 1. Also using signposts to kind of like let users know where they're going and what's happening next just helps them feel more confident. So for example, next we're going to listen to this section and have a quiz. It just helps people feel more secure. And finally, another suggestion is keeping it simple. More complex features, such as, for example, complicated registration features or complicated menu trees, can really discourage women and cause drop-off. I've just spent many years user testing services with women, and this is often one of the main sticking points. So keeping user journeys simple, keeping IVR menus simple, and minimizing the number of registration steps and IVR options, and user testing them with women as well as men to make sure that they are appropriate and you don't have too many steps. Moving on now to think about content. Often mobile health content is not designed specifically for women's needs as well as men. It's often not that relevant. So this means that they often don't value it as much as you'd hope, which again reduces their uptake and adoption. So to make sure that it is relevant and it is useful, some suggestions to think about are, first of all, making sure your messages are appropriate and they are relevant. So this means doing research into what is appropriate to female users and to their wider communities. In the toolkit that this is part of, there are some specific suggestions on how to do this research with women. And once you've got some content ideas, make sure you user test it. So for example, there was an mHealth service in Tanzania that sent messages out about expressing breast milk. But in the communities it was aimed at, this was considered taboo. And so this content was not well received by female users or their husbands. Also suggest doing research to understand what is relevant advice and what female users have the power to act on. So for example, don't recommend that pregnant women eat meat if meat is very expensive. Sorry, lost the sound there. So what I was saying was, do research to understand what is relevant advice and what female users have the power to act on. So, for example, don't recommend that pregnant women eat meat if meat is very expensive and women have limited control over household finances. Instead, you could recommend lower cost protein substitutes like beans or lentils and send these messages to financial decision makers as well. They're usually men. Thinking about language and technical literacy as well. Keep your messages brief, keep them simple and with clear takeaways. I think I've mentioned this already. Think about your language as well as using a language that is appropriate, using local languages that your female audience understands. Also, make sure you use terms and expressions that women use locally to talk about health. So, for example, a good example of this is HNI in Malawi and Zambia. They use the term healthy eating instead of nutrition in their mHealth service, as these words make more sense to users. BBC Media Action in their Kilkari mHealth service in India, they user tested words like ambulance and iron and found that those just didn't make any sense to women locally, so they removed those. So just making sure that you know what makes sense to your users. Thinking about voices and narrators as well. If you decide to use audio, some suggestions would be having a female voice or having a mix of both female and male voices. What I've seen is women often prefer to have to have female voices for health-related topics rather than male. Just user test which ones they would prefer and then test different ages. So, for example, on an mHealth service I worked on in Nigeria, Motec, they found a clear preference amongst female users for older female voices. And then thinking about your narrators, if you're talking about health and pregnancy, it's often a good idea to have an older sister or a female doctor narrator. Women tend to trust health content more if it is delivered by a respective female figure. So again, BBC Media Action Kilkari in India, they use a female doctor figure, Dr. Anita, who dispenses with the maternal health advice. And the user tested this and she tested very well. And finally, just thinking about storylines and characters. Often to engage people, entertainment and stories is a really good way to do this. Using audio dramas with recognizable health situations or with music or local celebrities can work really well. So get a sense of what would work and user test these concepts. Girl Effect in Bangladesh have been developing an audio drama for adolescent girls to teach adolescent girls about menstruation and sexual health, using a weekly storyline, using quite well-known voice actors and lots of music. And they've had a lot of uptake. They've had a lot of people dialing in every week to hear it. And then if you are going to use characters and storylines, use positive gender stereotypes as well. Don't just show mothers being the active participants in child health. Show mothers and fathers taking on active roles. This has worked very effectively. And thinking specifically about fathers, a really important thing about kind of making your service gender inclusive is including the men. Men are often decision makers. They may be the ones who pay for the service. They may be the ones who give permission for their wives to spend money on the service. They may also decide whether or not a woman owns a mobile of her own. So in order to enable these women's access, you need to be able to appeal to men. You need to gain their buy-in so that they see the service as valuable and important. And it's also really important to appeal to men to include them more in their child's upbringing. Empowering husbands and fathers and changing their attitudes towards childcare is actually one of the main drivers of improved healthy behaviours. So a number of ways you could do this is, first of all, creating content specifically for men. This could be, for example, creating a complementary content channel, which is aimed specifically at husbands or fathers, and it has specific information for them on how to be a good father and things they need to know. This has been done as a separate IVR line. This could be separate messages, or it could be a separate app. Two ways this has been done to great success is, first of all, in Myanmar. The mobile operator Ooredoo had a mobile maternal health app specifically for women or pregnant women called Maymay. But what they found actually was that men were using it more than women, and it was very popular with them. And actually they found out it was because these men wanted to know more about childcare. So then Ooredoo created a male version of the app called PayPay, targeted at men, with content around how to be a good father, which was extremely successful. In Bangladesh, another example, the mHealth service Aponjon, which is part of Mama, they sent out messages to 3 separate groups with tailored content for each of these groups. One for pregnant women and young mothers, but another one for fathers specifically, and then another one for other family members such as mothers-in-law. So it's important to consider them in content. Another way to appeal to men and bring in men is to encourage sharing. As we've seen, women often don't have their own phones and they may share with their husbands. So designing, if you're using audio, a group listening activity or interaction for husband and wives to listen to content together. Another way to do it is to add reminders into these messages, either during the message or at the end, for male users to share the content, the messages, or the information they've learned with their wives. So, for example, in Malawi, what we've seen is male users of Airtel's 321 nutrition service got very involved in the messaging and they wanted to discuss the messages and the information with their wives afterwards. But only 29% of the users of the service were female. So, as few women in Malawi actually own their own mobiles. So, building in messages to remind the male users to share with their wives could be a very good way to reach these women. Okay, so once you've got your content and you've got your platforms and you've thought specifically about how you're going to appeal to men, the last step is to user test things. Although people often do user testing with both men and women, there are actually some specific things to think about when you're user testing with women to just make sure that you have been as gender inclusive as possible and you're getting the best possible results that you can. Some of my experiences I've suggested here. The first thing it would be bring a mobile phone to the user test. As we've seen, women may not have their own mobile. And if you do, make sure that it's a mobile they're familiar with. Don't bring a smartphone, for example, if they're not familiar with them. Also bring additional top up. If they're using their own phone, they may be anxious about using their credit. Women are very, very price sensitive, as we will see a little bit later. Think about your facilitator. Who is going to do the user tests? In my experience, using female facilitators to conduct the user testing and thinking very carefully about age and appropriacy has worked well. A much younger facilitator may not be appropriate for an older female user, for example. Think carefully about your location. Go to the women. Don't expect them to come to you. Don't expect them to come to a venue in the capital city. Women, especially younger women, often have restrictions on their travel and where they can go. So choose a neutral location near to their homes if you're not going to their homes. Make sure that it's safe and secure and it's perceived as safe and secure. And it is a comfortable place for the women to speak freely. And often it can be quite difficult to get access to women in more remote areas and in places that have stronger social norms. So if you partner with an NGO, the NGOs often have very good long-standing relationships with women in their communities, so they can help you get access to these women in their own environment. And thinking about the format, as we've seen, women often have lower levels of confidence. They may be more worried about making a mistake and may be embarrassed if they make a mistake. So my suggestion would be to conduct user tests individually rather than in a group. And finally, facilities. You're talking to mothers, you're talking to pregnant women, you're talking to women who may have young children. So make sure that you can provide childcare at the venue so that your female users are not distracted during the user test. And just make sure that there are separate female toilets available. Okay, so we've looked specifically at the business opportunity. We've looked at the market and understanding women's access and use and ownership of mobile. And then we've looked at how we can apply some of these things to designing the product and service. Once we've got our gender sensitive maternal mobile health service, the next thing to think about is the pricing and bundling. And then thinking specifically, are your prices appropriate for women? As we've seen, one of the big barriers to women's access and use of mobile is cost, and in fact, it is often the biggest barrier. So there are a number of different ways we can get around this. Women, as we mentioned, tend to have lower incomes than men. They have less control over finances and they're much more price sensitive. So there are a number of ways we can get over the cost barrier. The first thing I would suggest is being transparent. Female users, they really often worry about their phone credit, perhaps more than men, and how it will be spent. So just make sure that it's very clear how users will be charged, when they'll be charged, how much, how frequently, and how they can unsubscribe. Offering freemiums as well is a good way of allowing women to test the service and then decide whether it is worth a subscription. If a subscription is too expensive, they can still access some free content. If they have tested it, they may be able to persuade financial decision makers to allow them to sign up for it. Another thing to consider is tailored pricing. If you have customer data, you can use your customer data to understand female users' call patterns and then tailor your pricing features accordingly. So offering step charging if users use a line for more than 3 minutes, for example, offering discounts for off-peak hours, or offering discounted rates for female users. This was done very effectively by the mobile operator Asiacell in Iraq, and they saw a large increase in female users because of their tailored pricing features. A number of other things to consider is offering bonuses. So offering an airtime bonus to users when they sign up to the mHealth VAS. Offering bundles, for example, bundling something together with mobile money. So, for example, bundling an mHealth service with a mobile money savings wallet can increase perceptions of the value of the service to female users if they see it as a way of saving for their family healthcare. And a final thing to consider, again, going back to the appealing to men part, is offering pricing for men. So a number of ways you could do this is, for example, offering a specialized tariff plan for husbands and wives, or offering paired SIMs, or offering special discount rates for fathers. I mentioned earlier Telenor in India and their specific tariff plan, which was aimed specifically at women. What they did was they sold a pack of 2 paired SIMs, whereas one of the paired SIMs was used by a woman, the other was marketed to be used by a male household member. So the tariff plan meant that there was free calling between 2 SIMs, and if one SIM was topped up, the other one was automatically refilled. And what they saw was a massive increase in women using mobile. I think 33% of their female customers were first-time mobile users ever. And that was purely because they included pricing for men. So thinking about these sort of things and appealing to men is a very good way to get over the cost barrier for women. One of the last sections we're going to talk about is now that we've got a very gender-sensitive product and service, we've got tailored pricing, and we thought about the cost for women. The next thing to think about is marketing promotion. So how will we make sure that women know about the service? Traditionally, BTL marketing channels for services such as, for example, blast SMS or call center campaigns or outbound dialing, these can often actually be a little bit problematic for reaching women. Often women can't read the SMS, or they don't read the SMS because they don't use it. They often don't answer calls because they either don't have a phone or they don't have regular access, or they're worried about who is calling them because they're worried about security. Traditional points of sales places, like in-person places such as shops, they often also don't work because they're not seen, they're not perceived as a place to talk about maternal health. So in order to reach women, marketing and promotion strategies will need to be more creative. And some suggestions for this include using community networks and NGO women's groups. Women often do have trusted sources of information, such as community health workers or NGO women's groups. So partnering with an NGO with a similar agenda can help you tap into low cost or often free marketing and distribution channels. A number of ways you could do this are, first of all, working with female community health workers. So these female community health workers, they are already trusted by both mothers and fathers. They already have access to the women in their own homes. Pregnant women and new mothers, they may not leave their homes very often. So if you're someone who can already go to them, this is really good. This has been done in, 2 examples here is, again, in India, BBC Media Action in Kilkari, they trained up female community health workers to promote the service, and they offered an airtime incentive for this to do it during their home visits, which had great success. In Uganda, Living Good set up female health workers as micro-entrepreneurs. So they signed up pregnant women and mothers they visited up to the mHealth service they were part of, and they earned a commission on any additional health products they sold. So there was something in them for them, but it was also part of marketing and promotion. Another way you can do this is using NGO women's groups. So tapping into already existing NGO groups, these safe spaces that are already accepted by the community, can help reach more women. Group members of groups like this often offer each other support and guidance in learning about or signing up or using a service or any problems they may have with a mobile service. So, for example, again in Uganda, the mobile operator Airtel, they had a mobile money savings product, and they promoted it through the NGO Cares female community savings groups. In Bangladesh, the mobile operator Robbie, a service I worked on with Robbie and the NGO BRAC, they tapped into BRAC's already existing adolescent girl groups, and they trained a number of these girls to be mentors, but also to sign up other group members to their education service, specifically for women, for a small bonus. So these are really effective ways of reaching women. But another way that you can consider is, again, going back to men and appealing to men. Men, as we've seen, and other family members, they're often the decision makers. And so it's really important that they form part of the mHealth marketing strategy. A number of ways you can do this. The first thing is having male figures in adverts and having them in marketing materials as well as women. So promoting the service to families rather than just women, and then portraying men as playing an active role in their child's health. This can have a big impact on male uptake of the service and therefore female uptake of the service. And another way you can get that male buy-in is by using those community health workers. As trusted sources of information, particularly for the fathers, they can target families and they can encourage fathers and men to sign both themselves up for the service, but also their wives. So in Bangladesh, the mHealth service Aponjan, which again was part of Mama, they use community health workers in this way. The health workers particularly promoted Aponjan to fathers who then signed up themselves up and their wives. And so it had a really big effect in letting women know about the service and then eventual uptake. In the final section we're going to look at today is the last part of the value chain, which is monitoring and improving. So we've understood our market, we've got a good sense of their access and use and the reasons behind it. We've designed a product that takes all these things into account. We've thought about pricing, which is gender sensitive ways to do the pricing. We've got some gender sensitive marketing and promotion strategies. The final thing to do is to measure success here and ensure that you are measuring the uptake of the service by women, but also measuring their use and experience. So M&E, monitoring and evaluation, it's really important because it can help you understand how your mHealth service is performing, the successes, but also the areas that need to change. And it can also give you data for decision making, data for understanding whether or not the service is meeting what it's set out to do. But often this is aggregated for all users. It's often not looking specifically at women. And so it's really important to understand this for women as well. And there are a number of different ways you can do this through focus group discussions and interviews. I'm not going to mention it today, but in the toolkit, there's a wider section on how to do this in person. But focusing particularly today on looking at commercial data and looking at business intelligence, some suggestions include collecting gender desegregated commercial data. So first of all, getting gender desegregated commercial data from mobile operator systems. So getting information, for example, around female and male ARPU, female and male number of subscribers, active and inactive users, and then also looking at churn rate. Now, this is really important because it links back to the business case. If you can get this sort of gender desegregated data, it leads back into commercial and indirect and direct commercial benefits for mobile operators. Just a word of warning here, though, this is not something that is collected by all mobile operators. Not all of them collect gender data. And if you rely only on data by SIM registration, this can often be unreliable because what we've seen is that men will often sign up for women on their behalf. So another way to try and get that is from your business intelligence data. So understanding your female user profiles and understanding your female experience. So that again means collecting gender desegregated data in your business intelligence tools. And you can do this either through customer profiles at registration and or gender tagging. So in terms of custom profiles, what this means is when a user signs up for the service, it's an opportunity to gather profile data at registration. So asking them just to fill in a bit of information about their gender, their age, and the location. And if you want to do this, just being aware again of the user journey and the kind of like technical literacy issues. So just making sure that it's very simple to collect this data and it's not too complex for the users. But thinking specifically about gender tagging, this has been done in a really interesting way by HNI Madagascar, which I'm just going to talk about a little bit. So HNI's 321 service is an IVR information service that runs across East Africa. And looking specifically in Madagascar, they introduced a low-cost and simple way to track male and female users to try and understand any differences in user experience, but also looking at user journey. So what this meant is when they dialed the 321 short code, they had a voice prompt asking them to press 1 if they were female or 2 if they were male. So based on which numbers they pressed from the analytics, HNI were able to identify and track the female users and look specifically at how they were using it and where areas of drop-off were. And so what they found actually was female users had a very different user journey. They had different content preferences and they had different drop-off points compared to men. So HNI were able to use that data to see where the issues were and like how they could improve their service to make it more appealing to women. What they found as well was, like, as I'd mentioned earlier, that female users had a massive increase in SMS usage, I think 140% compared to other Airtel subscribers. So there's a case for spillover there. They also found that a few users hung up after the gender question, or they selected alternate genders on separate calls, and that users thought that there might have been different content channels for men and women, so they were curious. And so again, that's around instructions, and HNI have added in instructions now. And what they also found was that the phones were being passed around the household, and so you'd have different people pressing 1 or 2 for male or female from the same number, and that's purely because of phone sharing. So I know that HNI are they're kind of improving this tool, but it's a really interesting way of a very, very simple way just to try and collect a bit more gender disaggregated data to understand their users in a bit more in order to make sure their service is as gender friendly as possible. So in this webinar, we're at the end now. We've looked specifically at, first of all, the business opportunity in reaching women. We've looked specifically at market assessment, how, women's access to mobile, women's use of mobile, and the reasons for the mobile gender gap. We looked specifically at product and service design and how some key tips and principles that you could use in order to make sure that your service is as gender friendly as possible. We've looked at pricing and bundling and costs, and we've looked at marketing and promotion, and we've looked at monitoring and evaluation. This webinar is part of a wider toolkit, which should be available soon. In the meantime, if you have any questions, please do feel free to reach out to me. I'm very happy to discuss any issues you may have. Thank you very much. Thanks for listening, and have a good day.